Hello and welcome to this week's episode of Uncorked with Funny Wine Girl. This is Funny Wine Girl, aka Janine Luby. And this week, I'm talking to a woman who's going to address a really important topic that whether you're in the field or the industry or not, we're all touched by it. Healthcare workers, the strain and stress that they have been under, especially since the pandemic, what has happened, and it's not an easy. I don't think it's an easy topic because there's so many moving parts, but it's important that we look at the people and the people that we rely on, and we've relied on so much that are under a lot of strain, for a variety of reasons. So we'll talk about that. Get to talk about a couple other issues because my guest is also involved in politics. She does not think of herself as interesting, but I do. She said, I don't know. I don't see myself as interesting, which is funny. I was thinking of that as I was taking a very short run this morning. I think probably the people who think they're so interesting are probably not half as interesting as they think they are. Meanwhile, other people are out there just doing stuff for the good of the world, environment, people next to them. That's the stuff I want to talk about, quite frankly, because they are interesting. So, my guest this morning, I always start off every week and I tell you how I know my guest. And here's why. And you've probably heard me say it a million times. Well, maybe that's an exaggeration, maybe not a million. But I think it is so important that we are open to getting to know people and being kind to people, which is first and foremost, because then throughout life, people will remember whether you're an asshole or not. And they'll remember, oh, let's talk, let's have a coffee. Maybe I can help you, or maybe you can help me. And it's not just about what you can get, but also giving. And so I think it's so important we're open to meeting new people, going out to events, whether it's political, whether it's business, whether it's a hobby, and learning from one another and keeping those contacts. So Jennifer Graham-Partyka is someone, she's like Jenny from the block, I'll say. We both grew up in North Scranton, and I'll admit as a kid, I don't remember Jen, but then we definitely had this connection in North Scranton. She's been supportive of me when I did a book, and that came out in 2010 about dating humor. And she was so kind and got a copy, and she's been supportive in that way. But she also will talk about her career as a nurse and the stress and strain that they go under. And she was kind enough to bring me in to provide some laughter yoga to her morning staff. And yes, I think it was 6 a.m, an ungodly off time of day, but they have to be on and working. So I came in, did some laughter yoga. I did it with the mask on, which was different for me, but I still feel that it worked. I still feel that her staff got something out of it, but I really appreciated that she believed in the power of laughter and brought me in. So without further ado, let me welcome my guest this week, Jennifer Graham-Partyka. Good morning, Jen. How are you?
Good morning. I am well. How are you, lady?
I'm doing all right. Doing all right. Living the dream, as we all are. No, I
The
say that
horrors persist,
sarcastically.
but so do we.
That's right. That's right. I say that sarcastically, but there are struggles in life. We all have them, but I'm happy to keep plugging away. And so I first want to start off because the healthcare thing, and I say thing, and I don't mean to minimize it. It's big and it's so tiered and there's so much to it. But before we get into that stuff, I just want my listeners to learn a little bit about you. And I know I was teasing because you said before about not being interesting. I think, my gosh, you're an advocate. You know all these people that we had coffee a week ago, and she's like, "Oh, let me hook you up with this person. Oh, what's your concern? Let me hook you up with this person." You're someone who is connected, and I'm guessing though you don't burn bridges because you're not an asshole. I say that half kiddingly, but let's face it, our integrity goes with us wherever we go, and people remember this. But I think you're interesting. Share whatever it is that you want to share about yourself personally before we talk about your profession.
Sure. So I again just think I'm just like everybody else. So I'm a wife. I'm a mom to three grown kids, grown and flown, and one stepson who is in college, and three rescue pets. I love to rescue, and by profession, I am a registered nurse. I am an active registered nurse. I serve on the board of directors for the Pennsylvania State Nurses Association. I serve on the board of trustees for the Nursing Foundation of Pennsylvania. I am the Glenburn Township auditor. I am a poll worker for the elections. I do all I can as a Democrat to help make sure that, people who are, maybe like, I guess what I want to say is that people retain the rights that they currently have. My gay friends and family can continue to get married and live wonderful lives the way they're supposed to. Women who require reproductive health care can continue to receive reproductive health care the way that they and their doctors decide to do so. So a lot of the things that I prioritize are things that I've learned are issues, not necessarily through my own life, right? Because I am literally what a Karen looks like. I am a frumpy, white, middle-aged lady who doesn't really have, hasn't really had a lot of challenges that a lot of other people have. But I've learned a lot from my patients. I've learned a lot from meeting people kind of in amid crises and, understanding what the reality of life, amid some of these socioeconomic issues or political issues might look like when they're manifested in a crisis. So.
Okay. All right. I'm going to say this just because you brought it up. I'm so sick of the phrase Karen, though. I got to say, no, I know, just because
I look like her though.
Yeah, we use but see, and that's how I just think it minimizes what you do. And I mean, again, we don't know how the struggles other people go through, but I always think of the Ally McBeal episode. I'm not going to apologize because I haven't lived your life. I didn't choose to be born the way I was born, and I'm living my life. Yes, we need to do more if we can do more, but I won't apologize or feel bad for that. And I sense that sometimes. I see it with younger people on TikTok or Instagram, like, oh, I'm sorry, I was born white. I'm like, yeah, that's just going away. That's honestly, it's actually, I don't see how it even helps. But anyway, no, the Karen term is just one of my things because it came about. It's funny and it's not funny. It came about during the pandemic, or it grew to popularity because that one woman, I remember Central Park. I don't think that term should be used for someone who's racist and also someone who just wants to send their meat back because it's not cooked properly. You know what I mean? I feel like we're doing that, but we do that a lot in society, which I wasn't going to necessarily jump right into this, but since I'm talking about words and how they're used, before we hit the record button, I said, let's talk about your change in role in healthcare because of burnout. And let's talk about that. So you were, and I want you to talk about your career, but the burnout term, we've been using that a lot. There's a lot of terms we use. And I will say, I don't think they're often or always used with any ill intent. I really don't. I think it's usually lack of knowledge, maybe not even thinking of the word. But as we talked about burnout, as you mentioned smartly or astutely, that puts the blame kind of on the person, the nurse, like it's their fault when it's not. So let's talk a little bit about that, like what it's been like, and maybe how we can look at that differently. It's not the nurse's fault that the system is doing what it's doing and they're quote unquote burnt out. It's just too much for them to handle, and they shouldn't have to handle.
Yeah. So it's funny. So I graduated from nursing school. And by nursing school, I mean the University of Scranton, with my bachelor's degree in nursing in 1995. So the entirety of that education, while I was in school, we all understood that we would be facing, in the 2020s, we were going to be facing the idea that we were going to have a mass exodus of nurses, right? We all knew this. The baby boomers who really, made up most of the, experienced, skilled, nursing workforce was going to be retiring. They were facing their 60s and 70s right around this time. We all knew that we were going to have a staffing crisis. Did we do anything different? Not really. So we took that anticipated staffing crisis where we really did not make things better in those, 25 years. We added to that a global pandemic. So now maybe the baby boomer who was going to, wait a couple of years to retire is like, forget it, I'm not doing this anymore. I'm not running into this burning building anymore. At the time, the very beginning of the pandemic, we did not have the vaccine. We did not have PPE. We were reusing, I'll never forget when President Trump went on TV and said, there's liquids. There's liquids you can use, and I'm like, these are disposable paper, N95 masks. So wouldn't you know it, 2 months later, we're using liquids, to disinfect and reprocess paper disposable N95 masks, being forced to do so by the Department of Health because honestly, there was no supply. There just wasn't a supply. So if I'm somebody who I have the option to retire, like I'm totally retired. Like I'm not doing this with the, like, it was just an absolute cluster. In Pennsylvania, we did our darndest to, Pennsylvania State Nurses Association, the nurses of Pennsylvania, the unions, everybody would, we'd have these established phone calls with the Department of Health, and they would blow us off. We weren't getting what we needed. So if I had the opportunity to retire during all that, I might have done so. Instead, I got promoted. So now I'm in charge of some of this messaging, which is incredibly inconsistent and, really changes every day and changes depending on who you're talking to. And it was nobody's fault. It's not anybody's fault. We were all doing the very best we could. In the meantime, we were facing, very mentally, emotionally, physically exhausting scenarios at work. And, really feeling like there wasn't a lot of places to turn because it was just a very chaotic time. So we lost a lot of the workforce. We got a lot of the workforce who just would not work in that system anymore. And I guess the thing that is most important to me when I talk about nurse burnout is again, the terminology. So when we say this, oh, that nurse is burned out, it's not really, like, that term puts the onus of the problem, which is systemic, on that nurse. And it's funny, one of my colleagues from Pennsylvania State Nurses Association said, we don't use that term. He was very clear about the fact that we do not use that term. And it's through nobody's fault. I mean, that term exists, but overall, it's just important to note the system's failure. We have more nurses now in the United States than we've ever had in our entire lives, right? And more registered licensed nurses in the entire United States, but we have very few that are willing to continue to run into that burning building. And there's probably a lot of reasons for it. There's never been a shift in nursing that has worked for a working mom. There's never been, in California, they have ratios, but it's never been, a really established set of rules that keeps you as a frontline nurse from maybe facing an assignment that is incredibly daunting, and where you might be placed in a situation where, two patients are circling the drain at the same time. There's never really been a layer of protection. So there's just a lot fewer nurses that are willing to do that. So you mentioned me, and I'll just tell you that I was an operations manager for an inpatient unit. During the pandemic, I did my time. I served, my community. I care very much about my community, but the 24/7 nature of running an inpatient 24/7 unit was just a lot. I had the opportunity to step away for a cushy little work from home job. But I will tell you that the guilt of knowing that I can take care of patients, like I can do this. I have a master's degree in caring for patients. So that guilt still keeps me at the bedside once a week. Like I'm still going in and moonlighting. I'm working like 50 hours a week just because I know that this is what, I've always wanted to be a nurse. I don't want to turn my back on patients, but I also know that, like, I did my time. I did everything I could for my community. And I think it's okay just to step away for just a little bit and maybe focus on what I need to get through, my days. So 24/7 for 3 years it's too much to ask of anybody. I don't know how people are still doing it. So God bless every single nurse who's still doing it, every single nurse manager who's still doing it. It has not been easy, and it's not your fault. So.
And I think a lot of people need to hear that. And I mean, ultimately, like you said, you don't know how they're doing it. In a realistic fashion, there's only so much they can physically do, right? Or at some point they are going to break or they're going to get sick themselves. And that's, then that's not going to help either. So I want to ask two things, and you can answer either of them, whatever order you'd like. I do follow what you post on LinkedIn, and you are very passionate, and you always, and I don't know I forget, I'll probably mess up the phrase, but is it patient rights or nurse rights or patient rights or nurse advocacy is patient advocacy?
Yeah, my hashtag.
Your hashtag, yes.
Yeah.
And it makes sense if I mean, sometimes we think of the first layer first, but sometimes we don't sit and think. Obviously, the patient can only get the best care if the nurse is, in the best place, if they're getting what they need and aren't exhausted. And that makes perfect sense. So I guess I have two questions. I want to get to what drew you into this profession, because it is a very caring, you have to be a caring individual, but obviously caring, but someone who's also able to not get attached literally to everyone, or you'd be, I mean, my gosh, I can't imagine. So I want to ask you what drew you into this. And then, but I also want to ask, like I said, I follow what you post on LinkedIn, and you've kind of written about some things that you believe are solutions or things to improve the system to make it better for nurses, which will make it better for patients. So, whichever one you want to answer first, I want to make sure we talk about both.
Sure, you got it. So I come from a family where if you don't work for the post office, you're a nurse. So these are my role models have been, blue collar, hardworking kind of people who are active members in their serving the community in some, way, shape, or form. And it's funny, my grandmother was like, she was so cute. She was from Alabama. She had this Southern drawl. She moved up here with my grandfather, like never lost her Southern drawl, and just took care of everybody. She had 6 kids. I have an aunt who's mentally disabled, and so she had to be a mom her whole life. On top of that, she took care of every single one of, her 6 kids, her 14 grandchildren. Like I said, my aunt who has never really, matured past 4 years old. And she was such an amazing example. Like, I love her. I'm actually establishing a scholarship in her name for the Nursing Foundation of Pennsylvania. She was just the cutest lady in the whole world. So I feel like I had that example. I feel also like I understood she was Granny. So Granny would tell stories about like patients she took care of. And I just remember thinking, like, she's so wise. Like, she understands so many things about people. And that's, I alluded earlier to the idea that, the patient's in crisis, like you're really meeting a patient kind of, during one of the worst times of their lives, and maybe it isn't that dramatic for every patient, but for some patients it really is, especially now I work at, one of the only functioning hospitals in our area. And it's a trauma center. And so we really are meeting people who have just had the worst day of their lives, and then we're also meeting people who, we just think, oh, we're going to write you a prescription, you're going to go home. Well, maybe they don't have a home. Maybe they don't have money to get the prescriptions. Maybe their wound is never going to heal because they don't have enough protein in their diet because have food insecurity. There's just so many things that being a nurse, you are privy to so many important things to understand about humanity and the things that people have to deal with. And I just think nurses are just the best, some of the best people in the whole world. And I will never stop believing that, because you're not in it for the money, you're not in it for the glory. You're certainly not in it because it's easy work. They're just, nurses are the best. And my hashtag is nurse advocacy is patient advocacy, because I've never met a nurse who wants something for herself or himself. I've only met nurses who are, opening their mouths on behalf of their patients. They're saying, listen, I need this so I can take care of your patient better, take care of this patient better. I need this because this patient needs this, So I really just believe that we are the #1 trusted profession in America, 22 years going. But there's a reason for that. Nurses are so smart and so skilled, and, we require so much education. We require, like, literally, every year, you have to, there's just minimum base, stuff that you need to know to continue to perform as a nurse. They're some of the smartest people that you're ever going to meet. We teach every resident how to not kill a patient. We teach, it's just, we are your frontline people. And very much like teachers, a lot of women dominated professions don't really get, what they need out of, the systems they work for, so being a nurse advocate is something that's incredibly important to me. And I feel like, 28 years later, I know a thing or two, and I'm going to do everything I can to make sure that the tough times that I had as a nurse that absolutely did not need to happen, I'm going to open my mouth about, and it's never an us against them thing. Like, I feel like, hey, administration, like, I would like for you to listen to me, and I want to help you understand what it is that and how can we work together for, like, I'm not trying to stir the pot without really finding a solution. I want to find a solution, so I don't want it to be like this for the kid, for the nurses coming up behind me. And I forget the other question you had. Was it about community involvement?
Yeah, well, I think you kind of answered it, but I know one of your posts, and I won't know the full gist of it, but it was a long post that I did read about some of your ideas as far as what I wish I could. I'm sorry, I didn't go back and look, but you were
That's
kind of
okay.
like suggesting like how to make things better.
Oh,
I mean, because obviously you've been in the front lines and and it's not an easy solution for any of this. But there were suggestions just to make it better for the nurses. So, I mean, like we talked about the women and men who've been doing it for so long, they're exhausted and maybe not having enough people. And if we don't have enough healthcare workers, that's a big problem for people who
yeah.
need care. But it was something specific that you were just suggestions that you were making about things
Yeah.
that can possibly be looked at to tweak in the system to make it better.
Sure. So we have on in the Pennsylvania, in Harrisburg right now, we have a Patient Safety Act, which is these are safe staffing ratios. And I guess what I want to say about it is like that's amazing. Like we would be one of 2 states in the whole United States that would have maybe a staffing mandate when it comes to acute care for patients, depending on the level of care that they require. If a patient's in the ICU, the ratio is 1 to 2. If the patient's in a med surg unit, the ratio is 1 to 4. Those are some, Linda Aiken at the University of Pennsylvania did a lot of studies about what are safe staffing ratios. And we proposed a bill. It's about 15, I think maybe 18 years in the making. It's taken that long to get it through the House. It's now sitting in the Senate. But Linda Aiken has done a lot of research about, what additional patients mean in terms of mortality, morbidity, things like that, things that can be measured. So it's very evidence-based. It's an evidence-based proposal, and like I said, the House went for it. It's sitting in the Senate. Hopefully, it will pass. And then in the midst of that, having been a manager for since 2016 in an official capacity. Before that, it's funny when you're an RN, you take on a lot of leadership roles unofficially. So like I've been charge nurse, I've been relief house supervisor, I've been, you take all of these roles that aren't really official roles, but all of nursing staffing, we have consultant companies that our hospital systems will pay a lot of money to bring in to tell us how to save money. And it's always cuts in the front lines, right? Because what they do is they'll look at your productivity for your past patients. So 2 weeks ago, my productivity was 86%. So if I want to replace, a healthcare role, I'm going to have to look at that productivity report and say like, okay, whatever your system decides is the number, the minimum number you have to be at, maybe it's 95%. You need to be in the 95th percentile to replace that position. But maybe it's September and I know that by December, every single bed in my unit is going to be full, so you're basically staffing for the past. You're staffing for your past patients. So all of my, pitches, which of course are not, it's just I'm asking people to think about it differently. I'm asking people to possibly start thinking about staffing for the future patient because, Janine and I are from Scranton. So in Scranton, we have no hospitals left. We have no hospital beds. They're just our hospital beds have gone. From Mid-Valley and Marion Community and Tyler Memorial and fully staffed hospital at Moses Taylor and a fully staffed hospital at, regional to much, much less. Mid-Valley's closed, Marion's closed. We've closed significant units at regional. So we don't even have an ER at Moses anymore. Tyler Memorial's closed. That was Wyoming County. So everybody, we have so many fewer beds. I think we can pretty much staff for the fact that we should be assuming that every one of our beds is full kind of all the time, and we should staff appropriately for it. So I call it the Graham staffing model, hashtag Graham staffing model, but it's basically staffing for the future patient, which I think, when you're an RN and I have the opportunity to maybe, do anything other than work in a hospital where I might get sued and where I might be facing, really high patient ratios, you can do anything else. But if I knew as an RN that I'm going to walk into a hospital and I'm going to have a safe staffing scenario, and I'm going to get a lunch, and I'm going to get a break. Like, these are things that we can do for each other, to maybe make that acute care setting a little bit more attractive, to the nurses who really are making the choice not to work in that environment. So I don't know. It's just we have to. I feel like until we solve that problem, nurses are going to continue to find reasons not to work in those front lines at the bedside. So, and that's really a detriment to our entire community, which is, my parents live here, your parents live here. Like, I don't want that. I don't want that for anybody. I certainly don't want it for my parents. That's not why I became an RN. So anyway, Graham.
You mentioned some really so interesting. As you were talking, I'm thinking about like there's a lot of data behind this. I remember I spent, and I forgot to mention, I spent 10 years working at Blue Cross, and I was in the communications department, but I did get to work with a lot of nurses because thankfully I didn't do the dry benefits. I was more, health management, disease management, quality improvement, quality assurance. So I got to write really like good stuff, like encouraging people to get mammograms and to eat right and go for walks, and to get their diabetes managed and all that good stuff. But I also worked with the nurses who had to do all that data for like the National Committee of Quality Assurance and all that.
Yeah.
And I'm thinking of that when you were talking about all the numbers, right? And of course, and I don't want to sound pessimistic, but the more I live as my 52 years, I find so much is just about money. I mean, almost everything in life. And I'm not saying most people, because I know, we're good people who want to do good things, but a lot comes down to the bottom line, almost everything. And so with those numbers, you're not seeing the person, you're not seeing the patient, you're not seeing the nurses, the human side of things, which is probably where it gets difficult. You also mentioned the closing of all these hospitals. That's scary. That's real scary. I mean, how are we functioning? And maybe you don't know the answer to that, and it's going to bridge into our next conversation about politics. I mean, is this on the radar for folks to go, yeah, people are going to die?
Well, God bless people like, Bridget Kozarowski and Jim Haddock and, Matt Cartwright, who listen to me kind of talk about these issues, because, and so I will tell you in very much in reference to what you're saying about how it all comes down to the money. Like, I'm not going to say it is not important for a hospital to be financially healthy, because this is the situation we're facing when they're not. I feel like I understand that my master's degree is as a nurse executive. And so I've taken, it's kind of like an MSN and MBA kind of rolled up into one. So I understand the business side of keeping your hospitals financially healthy. I also understand that in order to do that, you need to make sure that there are not closed units in your hospital. You can't close units because of staffing. You can't treat your staff so badly that nobody wants to work for you, and then close your units because of staffing, and then blame nurses when you go under. Like, it's not, we have specifically, I don't want to get in trouble for
okay.
for bad mouthing a hospital, but
yes,
some very mismanaged systems in northeastern Pennsylvania, and it has caused, the staffing crisis that they're looking at. Nobody wants to work for that system because you treat nurses really badly. So the financial health of our hospitals is incredibly important. I just think there's different ways to create that financial health, and certainly being incredibly good to your staff, and so much so that they're not going to leave. You're not going to have turnover. You're not going to have, frontline people who don't want to work for you because they question your ethics, or they question your business practices, or they question, the way, the future of your organization. You need that financial health. But in the meantime, I continue to try to ask our representatives to consider that maybe their advocacy on behalf of patients would be helpful as well. It can't just continually be the nurses saying, hey, listen, we have a solution. We understand this system or this problem, and we want to help. It's important that maybe some of the people with the actual roles in government, do a little bit of that advocacy as well. So we're always grateful. Bridget Kozarowski is amazing because she's an RN who understands totally what we're talking about, and understands the needs of patients. But, she's one voice. We have another nurse practitioner, Tarek Khan, We have I believe, an LPN in the Senate. But all of that is incredibly important. So thank you, anybody who's listening to me. I promise we know what we're talking about. So thank you for continuing to consider our input.
When we met for coffee last week, we were talking a little bit about this stuff, and like you made the point of like a lot of times, especially in politics, legislators and that making these decisions that they don't have a damn clue about, basically. Which I mean, I think many of us can guess that, like the male politicians telling women what they can and can't do with their bodies, which is pretty much exactly what's happening right now. But they don't understand even the cost of things or how things work, and really, I don't think the average person, and I'm going to say this to everyone listening, make sure you do vote and think. And I'm not saying you have to know everything, but learn a little bit. And I completely say I am ignorant. I need to know much more, truly. And there's no way we can know everything. But think about that when you do vote, because these folks are making decisions that impact our lives, and not just our lives, but the people we love. And they don't know. I mean, we were having this conversation. They don't know how things work. And that's scary, actually. So it is important that people, if they're not in a political role like the folks you're mentioning, that they at least open their doors to have folks who are in healthcare come in and educate them, or at least raise awareness. And that hopefully is happening. Is that happening, Jen?
Sure. So I serve on the Pennsylvania State Nurses Association uh, Government Relations Committee and their Political Action Committee. And I also am a legislative ambassador for them. So we serve as resources for legislators who are, we review the legislation that they'll be voting on. We get a lot of stuff out of the Health and Human Services Committee. But we have an opportunity to look at that and weigh in and say, okay, we support this. We actually maybe don't want to take a position on this piece of legislation, or we oppose this legislation, and this is why. It gives us an opportunity to reach out to them. And I will tell you that I have given my number to literally every local politician. They do reach out when like maybe there's testimony needed. Maybe we had a Democratic traveling committee can't come to Northeastern Pennsylvania. I was able to talk a little bit to them. We had a Republican committee who invited us to come talk to them about safe staffing, Patient Safety Act. These are bipartisan things, because when you're a patient, it doesn't matter. Like, it doesn't matter what your party is. Like, there's one way out of this universe, right? And like, you're probably going to need a nurse somewhere along the way. You're probably going to need, acute care. You might end up needing chronic care. There's one way out, and it includes a stop along the way requiring, where you're going to need healthcare. So I think that I've been incredibly lucky that, like I said, people have reached out. I will say that a lot of people, the people I wish would reach out, aren't really doing that. I do try to connect when I see, opportunities for education. It's funny you mentioned, some of the things that you hear and see. Like in 2017, I remember like watching all of these like YouTube clips about these older white senators, House, representatives in Washington D.C. talking about women's bodies, and I mean, it was funny. It was funny how little they understood. If a woman's raped, their body shut that whole thing down. Like there was just so many things being said that are categorically not true. So many opportunities for education that I think that's what sparked kind of my outrage. Like, are you smarter than a fifth grader? No, you're not, because your fifth grader understands that the stuff that you're saying is not true. Like, otherwise they'd fail their biology tests. So there's a lot of people out there saying a lot of things that are categorically not true. I try to reach out to those people if I catch them, but the onus is not certainly, it isn't my response. It's all of us. If we all see things that we are not liking, their job is to represent us, so I will always remain an educational resource, but also, if you're asking me for my opinion, I'm going to tell you my opinion. And if I disagree with you, I'm going to have reasons why I don't, why I disagree with you, because some things are simply not, opinions. There's certain things that are just categorically not true. So I try to seize those opportunities and correct people where I can when it comes to things that affect my patients.
And that's important. And last week I had on Republican PA State Senator Rosemary Brown, and part of our conversation was about information and information on social media and the facts. And
Yes.
this wasn't a partisan conversation where we're talking about anything, particular party or whatever, but just information. And you mentioned it's not on you to go out and correct everyone. I would say, and this is what I had said to her last week, like I would just remind people that the onus is on us to be educated, because there
Yes.
is too much misinformation. And it's great that we have people like you who are advocates and who are saying, excuse me, that's not truthful. Let me help educate you. So where we can educate, I think that's important. But I think what's more important, because we've gotten, I don't mind saying, I'm not, I'm just saying this myself, this is how I feel. We've gotten very lazier to a degree and dumber in this country, because we're sitting resting on our laurels and taking information a lot of times that's not real and it's not factual, and we pass it along because some people actually believe some of the things that they read in memes are true, and they're forgetting the difference between truth and humor, or like and in facts and humor, I should say. And we won't go into how that whole big mess started or whatever, but I just want to remind people, and I used to say to this to my students when I taught at King's part-time, we need to do a little more research. We've gotten lazy. Just because you see an article, it could be like bullshit.com is the name of the website. And you're like, do you know? It's like, no, 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 no. That's not a good source.
Yes.
Like for me, health wise, when I look at stuff, I trust things like the Mayo Clinic, Harvard,
Right.
Harvard Review, Forbes, Johns Hopkins, like, organizations that I feel are trusted, and CDC, I mean, other people might say, oh, I don't trust the government, whatever. But I mean, you do have to be careful. That onus is on us. Don't be spreading misinformation. Or if you read something, if you can't find a real good source, reach out to someone like you and say, is this true? And I think we need to be doing a hell of a lot more of that.
I always refer people also to scholar.google.com, peer reviewed, there's just so many things, especially like in the midst of, the vaccine conversations, like I literally, I'm a big fan of scholar.google.com. You can find, I almost feel like you can find science to tell you anything that you want to believe, but on scholar.google.com, if you're parsing out your most recent studies, your peer-reviewed studies, there are some filters you can put on that will absolutely give you it'll give you kind of like the raw truth. You can, cite the sources like you explained, like Mayo Clinic, Johns Hopkins, a lot of those are amazing resources for medical information, and then, your news sources, you find a news source that you trust, think about who's going to, who's invested in this, and I love like NPR, but because I think, it's public radio, it's not, there's no real, corporate entity that's, benefiting from stuff that's coming out of NPR. So whatever it is that you decide you're going to trust, just make sure that you understand why you trust that site, and that goes beyond, of course, healthcare. It's all of it. And, I think living through the disinformation that we all experienced during COVID, and maybe even, previous to that was, the election before that was very disheartening, because we live in an age where like every piece of truth is at our fingertips. Like, why are we choosing to believe things that that number one, if you really think about them, don't make any sense, but number two, we can disprove in one more click, So I agree with you. We are responsible to make sure that what's coming out of our mouths and what we're posting on social media is actually, true. So
yeah, I don't think people understand the power. And and again, I don't think it's ever done with an ill intent, but I think we've become kind of it's lazier, I mean, and I would see that even with students, like they wouldn't use good sources, or they would just pick the first thing they clicked on or didn't want to spend time. And it's like, if it matters to you or it matters to someone you love or whatever, like getting the right information is the right thing to do it. And especially if you're going to share it, don't, make sure that what you're sharing, because what you're sharing, someone else is going to share. And honestly, that's what, I mean, let's face it, that one documentary about the what the heck was the name of the company that basically changed and shifted elections because of the things they were putting on Facebook and how quickly it spread. And they were not truthful things, but
Yeah.
that can happen. It really
Yeah.
can when you have that at your fingertips. So we all have to be more responsible about that.
Yeah.
So I want to ask you too. We mentioned a little bit about politics and the folks listening. So you're active here in northeastern Pennsylvania with the Democrats, and we talked about this, which is great because I'm hoping to get a conversation with Keir, who is running for state as attorney general. Is that the right word?
She's running for attorney general. Yeah.
Attorney general here, and hopefully I'll get her on the podcast, which would be phenomenal. Tell me just a little bit about personally why you're involved in politics and the Democratic Party, and what that means to you, especially as we have to realize that the elections are coming up and April is the primary, and then of course November. It's a very big year. So yes,
Yeah.
I'll be shutting my TV off because I can't stand seeing those ads and hearing a certain politician speaking too much. But tell me, why you got involved and what your activism is about.
Sure. So, it's interesting. I remember, years ago here in our locality, we have a county prison, and there was a woman who delivered a baby on the floor of her cell. So she was calling for help. She did not receive the care that she needed. So this is many, many years ago. I want to say it might have even been, in the 2000s, not even the 2010s. So I think that that's where it started for me locally. At that time, we had a county commissioner race coming up, and some of the things that the existing county commissioners were saying about that incident were so unsettling to me. Basically, the scenario was that this woman had a nurse on staff in the hospital, a nurse on staff in the prison, and who was not at the woman's bedside, and they just kept referring, the nurse was there. No, that isn't actually what happened. So it was kind of in the name of patient advocacy that I started, paying attention. I also think, when 9/11 happened, my kids were babies. I was a good Irish Catholic girl. I had 3 kids in 3.5 years, and was busy watching, SpongeBob every day. So when 9/11 happened, I did not understand the history and the politics and everything that kind of went along with that. I think that sparked my interest, but this particular incident in a local county prison really, really, made me start speaking up in the name of patient advocacy, because what happened shouldn't have happened. So it started there.
And let me stop for just a second. And it's just for the listeners. What happened with that scenario?
Oh, the prison?
Yes.
Yeah. So there was a minority female screaming for help. And I guess she had been in and out of the hospital a few times. False labor happens to literally every single woman, like who's ever, especially with your first, like you're not, you don't know what's labor, what isn't. So they had taken her, I guess, to the hospital maybe 2 days before it was false labor. So this time she was in full active labor, wadding up, taking wads of toilet paper, dunking them in the toilet and throwing them at the camera so that somebody would come down to her side. And so people did. The COs were coming and they were checking on her at the prison side or at the side of the cell, looking at her and just blowing her off, saying, "Oh, it's false labor." And so, well, she ended up delivering an infant on the concrete floor of our prison. So that was really the story. To me, it was astounding that would happen. At that time, I just believed that because I took care of inmates in hospitals that I had worked in, I did not ever really question the quality of the care that our inmates were receiving. It disturbed me a lot. And I got mouthy. So I feel like my kind of outspokenness started there, but through the years, I've been, I've found scenarios where I felt it was appropriate to, get involved. So, I think I like worked the polls for a friend of mine who was running for a local office, standing outside and will you consider please voting for, this candidate? And so I just had that opportunity just to try to be helpful for friends of mine. And then we moved out of Scranton. We moved to the Abingtons. When my husband and I got married, it's my second marriage, we suddenly had 4 kids instead of 3. So I needed an extra bedroom. We bought a 5-bedroom house in Glenburn. And when we moved up here, there was I met a woman standing outside my new polling place, and she said, can you write me in for Democratic Committee woman? Absolutely. She was the cutest thing. I loved her. And then when I went in, there was nobody for Democratic Committee man. So I thought of my husband and I wrote him in. And 2 days later, he got a certified letter from the county saying he won an election. He's like, what did you do? So he literally won with 1 vote. And someone that we knew was going to, when Sid Michaels passed away unexpectedly, he was a very beloved, representative here in Northeastern Pennsylvania. And filling his role was going to be, a very daunting task for whoever wanted to step up for it. But there was somebody that we knew that was interested in the role. And so she approached Jeff because he was the committee man and said, how do I do this? What do I do? And so I helped her, we helped her kind of get that campaign going. She's done an amazing job since then. We're very proud of her. I'm very glad that we had the opportunity to create that create that possibility for her, because she's done such a good job.
And what's her name, Jen? I don't know.
Oh, sure. So I'm going to brag about Bridget Malloy Kozarowski. She
okay.
did an amazing job. She's actually your rep. So love her. And Jeff, had a little bit of a role in that. I mostly did all the work for him on the committee because as his proxy, because he, I did kind of rope him into it. So I was happy to do the work and happy to represent him as his proxy for a lot of that stuff. But that's where I think the more active role came in. When she was running for office, we asked the Pennsylvania State Nurses Association for an endorsement. And that's how I got involved in the Pennsylvania State Nurses Association. And in the midst of that, immediately gravitated to our Government Relations Committee, Political Action Committee, Legislative Ambassador. And so that's kind of where it started. So, and since then, I have been incredibly lucky to, host John Fetterman and Giselle in my backyard. I've been blessed to meet Joe Biden twice. I've been, really happy to do fundraisers and meet and greets in my home here in Glenburn for, any Democratic candidate who feels, that they'd like to come up and meet our friends. I'm active in Dalton for Democracy, which turned Dalton, a very red area of Northeastern Pennsylvania, turned it blue for 2 elections in a row. So these are just small grassroots, things that we can do to kind of change the world we live in. And I'm happy to be part of it. I love what I do. So it's fun for me. This is literally what I do for fun when I'm not working. So
That's awesome. I should say, Sid, I knew years ago, we actually performed improv together. He was a lovely man.
Oh, that's right. I forgot he did that. Yep.
Yeah, he was a lovely man who passed away way too soon. Yeah. So those were big shoes to fill. Yeah. So you mentioned you had John Fetterman in your backyard. That's pretty cool. Interesting. How is he doing now? I'll admit, I don't see as much because I know, and this is a whole different topic. We could probably go off on a separate episode when he talked about taking a little step back or a break because of his own mental health. And it's so, I mean, of course there was ridiculing, there's nonsense. I mean, there are people who understood and there are people who didn't. But I actually have not seen him in the news that much, but maybe on the Democrat side, you've been hearing more about, like, is he getting out there, to campaign for other folks, or what's going on with him?
And I will tell you, it's funny. His wife, Giselle, I began to consider her a friend. I just absolutely loved her. She's the sweetest, kindest woman. She has disappeared from social media in the midst of the Palestine-Israeli conflict. Has really, John has taken a very, very firm pro-Israel stance and has lost a lot of his more progressive, younger followers in the midst of it. There's a lot of nuances to that conflict that are, people my kids' age are seeing very differently than my husband has a his family's Jewish. And so they, you know, it's very funny within my own home to see that. I shouldn't say funny. I don't mean funny. I mean, it's very interesting to see in my own home the two ends of you know, the arguments on either side of that conflict. So John has actually, you know, he kind of went in with this incredibly progressive, you know, agenda and platform, and, you know, kind of base, and has been, you know, they've been pulling away. In the midst of that, though, Giselle has taken herself off social media. So and it's funny. You know, occasionally we'll text, like I sent them a Christmas card. You know, I just love her. I think John is dealing with his own political, you know, consequence right now. Hopefully it can resolve, because I'm very afraid that, you know, I listen to the things my kids say and my kids' friends say, and, you know, and their friends on social media. You know, I'm very afraid for this coming election that we have this is a disengaged population. You know, they're not thinking of, you know, the reproductive rights, or the fact that their gay friends, you know, marriages may be at risk, or, you know, access to healthcare, health insurance, you know, things like that are really, they're really on the chopping block if we don't have Democrats elected. So I really, you know, I hope and pray for many reasons. I hope and pray for a quick resolution to what's happening between Israel and Palestine, and the Gaza Strip. And, you know, I really hope that before the general election that we can re-engage this population, because those kids they're very disappointed in a lot of what they're seeing. So.
And, you know, it's interesting you say that, because in the beginning, early when this started, you know, everything was heating up. I remember that John Fetterman's name was that he was getting flack, but it's interesting. Again, maybe I'm wrong. I thought he was posting support for Palestine and getting blowback. But maybe it was the opposite, that I just opposite, honestly, it was a quick little, you know, blurb through quickly looking through social media. And to that point, it's interesting, because I can completely understand where, you know, their interests lie, or where the younger generation is thinking. But I think we go back to what's important with, you know, it is great to think globally and to put your heart into that, but where you live is where you live. And we do need to re-engage them, because otherwise, you know, if they don't vote, decisions are going to be made that they're not going to be happy with, if they're not, you know, getting out there to vote.
Yeah. Yeah. And like I said, I love that they're engaging. I love that they're protesting. I love that, you know, because that's democracy in action. And I'm glad you feel, you know, strongly about what you feel strongly about. And I'm so glad that people are advocating for, you know, for vulnerable populations, you know, and when you look at that situation, it's very clear that there's a vulnerable population, and you know, it's terrible. It's absolutely terrible. But I also completely 100%, you know, our generation understands very much that, you know, nobody ever wants another Holocaust. Nobody anti-Jewish sentiment is not something that's acceptable or palatable to, and I don't think that my kids' generation is saying that. I think they're saying we don't treat anybody this way. But
right,
fortunately, it's not. It doesn't translate. So in any case, I am worried for this election, because I think that the people that were so, you know, grassroots engaged, you know, registering people on college campuses, you know, all that stuff, like that generation is a little bit like, I'm not voting for Biden. I'm not voting for, you know, Casey. I'm not voting, like, you know what I mean? Like, I'm not voting for Matt Cartwright. I'm not, but, you know, I think that they see people as party to a situation that they're not comfortable with. And, you know, I begrudge them nothing. I just hope that there's an opportunity to heal before the next election, because we cannot do another 2016. We just can't. I can't watch that happen, you know. So I'll do everything on my part, and I will, you know, if you feel like you need to talk to, you know, if you feel like I can help you maybe reach across the aisle and talk to, you know, some of these politicians, I'm happy to try to host something, but I just I don't want us to end up where we were in 2016 and face 4 years of that nonsense again.
Believe me, you're you're the one of many that feel that way. Yes.
Yeah,
Yeah,
I'm
absolutely.
sure.
And it's interesting, it is great younger people are engaged, and I exactly your point of the thing is that no human deserves to be mistreated, right? And I think
Exactly.
that's where they're
Yep.
coming from, but I think, and I don't mean this to sound condescending, I think there's something that obviously comes with age too, where you go, okay, that sucks, but need to keep moving on because life will, whether we choose to do something or not. And so hopefully, like you said, hopefully they can get re-engaged because, while things are not happening maybe that they want, at the same time, it can get, if they don't cast their vote, things are going to be decided for them basically. And
Yeah.
that's
Yeah.
and then not just to kids, that's to any age person who's
Yeah.
out there who's like, disgusted. Because again, I am a Democrat, but like I said, that's Biden would not be my first choice, as far as a candidate goes. I was a Hillary fan. I still love Hillary. And, it sucks
Yeah.
that we live in an age where we're such a not progressive, but we're such a like big country that's like the quote unquote best, but yet we've yet to have a female leader. And that
And
speaks,
everybody else has.
yeah, I know, seriously,
Everybody,
many
I
countries.
don't
And
know.
it's like, to me, that just speaks to the misogyny and all kinds of crap that's in our country. But I
Yeah.
mean, again, he's not my first choice, but I will absolutely give him my vote because I mean, like I said, a bowl of guacamole could run against Trump, and I'd be like, yeah, let me get my chips out and start dipping. I mean, like,
Yeah.
yeah,
Yeah.
yeah, for so many reasons. Anyway, but yeah, I mean, anyone listening, not just kids, but anyone listening, when you don't cast a vote, or if you do something like, oh, I'm just going to write in, Homer Simpson, you're throwing votes away. You're not doing anything at that point. So if you have to look at it as a lesser of two evils, which I am honestly, then that's what I'm doing. Cause
Yeah.
at least
Or
it's
think
the
of it as voting against someone,
exactly. Yeah.
and even still, I'm not, but we'll see what happens. I'm hoping, honestly, I really am hoping. I think that the conflict is becoming obviously distasteful to a lot more people who had not considered that maybe that was, the case. And I think that our support of some of what's happening um, is diminishing. I think that people are less apt to support some of what, and honestly, to the credit of this generation that is like, listen, look at this a little closer, look at what this, and so I mean, maybe I wouldn't have considered, it if I didn't have, people my kids' age saying, no, consider that, and who knows better than us, right? Like what it's like to bomb a whole nation because, a terrorist cell is doing stuff inside of that country, like it doesn't end well, Afghanistan was a disaster, like Iran, Iraq was a disaster. Afghanistan was like, we did not make that situation better. Making the entire country suffer for what a terrorist organization is doing, is akin to, us picking on, Alabama because the Proud Boys had a rally there. So, you know what I mean? Like, it's not, it just doesn't translate well. So I'm hoping that we can come to maybe some resolve and a solution before, before the Trump versus Biden election, which I'm
Yeah.
sure we're facing in 2024. So
Yeah. Yeah, absolutely. All right. Well, as we get to wrap up here, is there anything else that you wanted to say? So I do want to, my hat is off to you. I do want to say I admire you. And, you said, oh, you're not interesting, but what you're doing, it's not, it's valuable, it's powerful, it's wonderful because you were engaged when you saw a patient being mistreated, and like that's at your heart, and it got you, it lit a fire, and here you are, you're hosting Fetterman, you've seen Biden, and you've spoken, you're, and not just seeing like it's, oh, that's a cool brush with whatever, but you're engaging people, you're utilizing your power and your ability and your knowledge to get people elected who will do the right thing by people, as far as healthcare goes. And I admire that because I bitch about a lot of things, and I'm like, maybe I need to seek the pathways that are like, I go out and I pick up litter because we have so much damn litter in Scranton. And I'm like, why are people doing this? But like getting involved more with the environmental group might be helpful to me. Like, so instead of bitching, what I want to say is we should do something. And that's what I feel that you've done. So I admire you and I want to say thank you. But anything you'd want to say in closing that we didn't talk about, and it could be about anything that you just wanted to share.
Well, I just wanted to share that this morning I plugged in your honor.
Yay!
I've been looking at, we had recent street project happening, paving the streets and stuff, and some of the gentlemen who worked here, and I'm so grateful to them for fixing our roads, but they littered, and I've been walking the dog looking at it. So this morning I took a bag and picked up the litter all around my neighborhood. And I just feel like I want to say the same to you. Like, I want to just thank you for having, number one, for doing what you do as far as laughter yoga. I think you referenced the fact that you brought laughter yoga to my team, in the hospital. And, for as much as, they were like, we're doing what at 6 a.m. What do you want to see? Like, they ended up having, every single person had a smile on their face. Every single person had, so we appreciate that. It was a moment we could, kind of connect as a team and do something silly, first thing in the morning, and feel good about our day and walk away with a smile. And I love that you quoted, some actual, we used evidence-based, practice when we were smiling. I appreciated that very much. And just also that you have you create this opportunity for people to talk about what it is that they do, and maybe how to make the world a better place, one little step at a time. I love the think globally, act locally. Like, I've 100% done that my entire adult life. I've tried to think about how it is that I can make a difference in my community, and hopefully that is something that spreads. So I appreciate very much that you're creating an opportunity for people to talk about how to make that happen in their communities. So my hat's right back off to you, lady.
Okay, we're both hatless at this point. Okay.
Who
Well,
wants a
thank
hat head?
Yeah, right. No one's that. Well, thank you. And I should mention, because Jen brought it up so real quick, just because it's near and dear to my heart, plogging is a Swedish term or practice in which they go out, and you could say you don't have to jog, but you could walk, run, you're just outdoors doing something good for the environment, picking up litter. It's been in the news a little bit more the past couple of years. I've seen it, and I love the idea. And I do love my city, but every city, your home always has there's good, and there's always going to be challenges, and a lot of people litter. And I grew up in a time when it's like, and my own parents' values, what we were learned. Like, to me, it's a cardinal sin, almost close to murder. I don't know why, but it is. I'm like, how dare you? Because I've yelled at people who've thrown stuff right out their windows. I'm surprised I haven't been punched, but it to me, it's just near and dear to my heart. So if you can do that, you can make a big impact in your community. And you might think, because I've had people tell me this, why bother? It's just going to keep getting more litter. But imagine, maybe it's only an inch worth of litter instead of 5 inches. So I do care. I think it looks disgusting when there's all that litter. So if you can do that, and I think it's great to do maybe with your kids, it's a great thing to give back. Real simple. Get a bag or two. You don't have to spend an hour or two doing it, but if you're out for a walk, out for a jog, and you're not worried about your time, you're not training for a race, you stop along the way, you cover maybe a quarter of a mile or a mile, and you pick up some stuff, and you'll be amazed. It helps you make the community look better, and I'm sure you'll feel better about it too. So thank you so much, Jennifer, for joining me today. It's been an absolute pleasure. My listeners, we gave you a lot to think about, and I hope you will do that. And Jen, you were on LinkedIn. Is that okay if people wanted to even give a shout out to you?
Absolutely. Yep. I'd love to connect.
Okay, great. And I will put that in the show notes. Jennifer Graham-Partyka. In the next couple of weeks, I'm so excited. I've been connected with a couple different women actually to talk about, again, something I've been opening my mouth about a lot, perimenopause and menopause. We need to talk about women's health. So I've got some folks coming up with that. Megan Alpert, who has Joy Wealth Partners. So we're going to talk about wealth management and, the connection between happiness and money and all good stuff like that. So a lot of interesting guests. Every single person I have on here, I believe, is interesting. Every woman is fabulous that I've had on. So a lot of good reasons to listen in the weeks ahead. And as I always say, I thank you from the bottom of my heart and the bottom of my wine glass.